So if you work in primary care, one of the things that you probably are very much exposed to are brief screeners. And particularly related to mental health, you'd probably be thinking of like the screeners like the PHQ-9 or the GAD-7 that measure depression and anxiety respectively. Those are great measures and they have a function in primary care, particularly to help identify patients that we wouldn't be identifying if we didn't ask these questions specifically. The one thing that they are limited in is that they're symptom specific, that they only ask people about certain classifications of symptoms without looking at someone's context and then also without looking at their overall functioning. So in addition to the PHQ-9 and the GAD-7, the one thing that we love to recommend is to use quality of life measures or overall functionality measures. One of the more common ones and the ones that we use at Community Health of Central Washington is called the Duke Health Profile. It's a 17-item screener that loads on 4 composite scores of social health, mental health, physical health, and then just general health. And the one thing that we really enjoy about it is, one, it's brief, so it can be used in primary care regularly. The other thing is that it doesn't focus on symptoms. It focuses on quality of life and functioning. So when we're working with a patient, particularly with something like chronic pain, where most likely they're going to have pain for a while, and if we focus on symptoms, that might lead us down a road that isn't winnable. This allows us to focus on different things, maybe some things that the patient actually has control of, their behaviors, their actions, their quality of life, and their functioning. And this is something that we use not only for the first visit, which we're going to demonstrate in the next video about how to use the Duke and how to introduce this to patients, but we use it in subsequent visits to track progress and also give feedback to patients on how they're doing, again, in quality of life functioning. The other thing that I like to do when I'm meeting with someone new is do a brief little screener about how things are going on overall. Does that sound okay? Okay. All right. So I'll give you this. You actually don't have to fill out anything. We'll actually do this together, and that will just help you follow along with the questions that I'm asking. The first 7 items of this screener, I'll say the statement, and then you're just going to respond, yes, that statement describes me exactly. It somewhat does, or no, that doesn't describe me at all. So for instance, the first one is, I like who I am. Does that describe you exactly, somewhat, or no, not at all?
Somewhat.
I am not an easy person to get along with.
Somewhat.
I am basically a healthy person.
Doesn't describe me at all.
I give up too easily.
Somewhat.
I have difficulty concentrating.
Yes.
I am happy with my family.
Somewhat.
I'm comfortable being around people.
Somewhat.
Now for the rest of the items, the responses will be none, some, and a lot. And today specifically, how much physical trouble would you have walking up a flight of stairs?
Some.
Running or jogging the length of a football field?
A lot.
Now over the past week, how much trouble have you had with sleep?
A lot.
Hurting or aching in any part of your body?
Some.
Getting tired or fatigued easily?
A lot.
Feeling depressed or sad?
A lot.
Nervousness?
A lot.
During the past week, how often did you socialize with other people?
Somewhat.
How often over the past week did you partake in specific social activities like going to meetings, movies, church, sports, parties?
None.
And then during the past week, how often did you stay at home or in a hospital because of being specifically sick, injured, or having another health problem?
None.
All right, so I can take that from you. So let me show you what this kind of gives us here. So this gives us scores on certain life areas, and we look at the first 4 here of physical, mental, social, and general health. Best you can do in any area is 100. Closer to 100 you get, the better. Anything over 70, we think you're doing a decent job in. And right now, it seems like physical and mental health are a little bit lower, and I'm sure that's what we'll talk a little bit about today. Social health is a little bit higher at a 40, and then general health is about a 27. So if you come back in, we'll do this again just to track it and see if there's any changes or improvements over time. Sound okay?
Okay.
Okay.
As you can see, completing the Duke took a few minutes to do with the patient, and there was a lot of great information that I got by completing it with them that is going to help streamline my visit and help streamline my contextual interview that I do with the patient. The other thing that you can do if you don't have time necessary to do with the patient is develop workflows on helping your medical staff, support staff, give patients a Duke to fill out. It's often a question that we get asked a lot. What should we do when patients are waiting for a behavioral health consultant to come into the room? One of the easiest things that you can do is have them complete the Duke.
And then maybe before, and this is one of the workflows that we have in our clinic, as they enter into the clinic for the BH appointment, they get handed a Duke that they fill out in the waiting room, so it's already done. However, if you can't have that done, or maybe if we didn't get to the patient and they were able to complete a Duke, this video shows that it is possible to do the Duke with a patient in very few minutes that will really help streamline your visit and your contextual interview that you'll complete with the patient.